This podcast is for informational purposes only. It is not intended to provide medical advice. It exists only to entertain. In 1849, in a Baltimore, Maryland area hospital, two physicians are discussing a curious case of a man brought in uttering nonsense and appearing to be quite ill.
This man is in a bad way for sure. What do you think is going on, Dr. Reynolds?
I'm not sure yet, Dr. Roderick. You were here before me. What symptoms is he having?
Well, he appears to be out of his mind, medically speaking, of course.
Of course.
He's in and out of consciousness, muttering things that don't make sense. He appears to be having intermittent hallucinations of some sort.
Is he drunk?
I'm not sure. We don't smell alcohol.
I see. His clothes are threadbare and they appear to be poorly fitting. Do they belong to him?
He was found in the gutter.
But do we know if those are his clothes?
How would that even matter?
Because nobody would buy poorly fitting clothes. They likely don't belong to them, and that's a clue.
To help make this diagnosis? I'm confused.
What gives you an altered mental status, nonsensical speech, hallucinations, and poorly fitting clothes that don't belong to the patient?
Again, I feel like you're hung up on the clothes thing. See what
This is classic Baltimore voter fraud.
What?
You're new here in the city, Dr. Roderick. We do things very differently in Baltimore. Voting can be very hazardous to your health here.
Did I mention he has a fever?
Yep, definitely a voting problem.
I'm a bit skeptical.
This is going to be a plausible explanation for this story, believe it or not.
I don't believe that. But if it were true, what would the treatment be?
Abstention, of course. Because of the voting bit.
Yeah, I know.
It's almost a pun.
No, it isn't.
Throughout history, this is facts and there might be me. You gotta listen, you don't have to read. For historians.
Welcome, everyone. This is Poor Historians, a podcast delving into the archives of medical history. As three emergency physicians, we will explore the unusual ailments, treatments, physicians, and all related material having to do with the healing arts. I'm Max, and I'm joined here by my good friends and colleagues, Aaron and Mike. Gentlemen, what are we even talking about today?
Yeah, I don't know, man.
Nobody knows.
I know.
Unless the skit gave it away, but I don't know if it
Opening
does.
the chakras as part of medicine practice?
That's part of my practice.
Yeah, that's
I'm a
extremely
certified
close, but yet
Reiki
not
therapist.
at all.
Not at all. You're a Reiki healer.
Mm-hmm. Yep.
Have you guys heard my Reiki story?
No.
I had a woman come in with AFib with RVR, so very rapid, irregular heart rate, and it was going like, I don't know, 130, 140, lying still. And I was telling them what we're going to do. I do my thing. We're like, we're going to get some labs, check in and slow down the heart. And they're like, that's all great, but before you give me medicine to slow down your heart, can my husband try? He's an energy healer. I was like, sure. That's I don't see any harm. So the guy comes over and he like puts his hand on her chest in an area that was reasonable for mixed company and just kind of like made a face, and her heart rate dropped by like, I don't know, 40, 50 beats. I was very impressed. I was like, cool, man. That's pretty cool. Brought it down to the normal range just by.
And then what happened?
But still an AFib.
Yeah, still an AFib. Yeah. I think she went back up later. I don't know.
She definitely went back up later. Come on.
I've never used it at work. I don't like.
I
to
thought it
touch
was
people.
pretty cool. I was like, wow, you could drop heart rates on demand.
You know, it's actually famously, there was a experiment that was performed by a young lady who ended up going to Harvard where she debunked all of that. And that was like her entry into Harvard when she was 13 or something like that. So
Yeah, I tried it on my next patient and I got called into the vice president's office.
Well, no, but you gotta be aligned, right? There's
Yeah,
like a
that's
thing you gotta do.
I wasn't properly aligned with that next patient.
Well, before we get on with the show, how about we take a second to thank our sponsor, Artery Inc. This episode is brought to you by Artery Inc., a unique apparel company here in Milwaukee, Wisconsin. The tag phrase on their website says it all: wear your insides on the outside. But don't do that literally. Keep your organs inside, but check out Artery Inc.'s collection of anatomy-inspired shirts, hoodies, and other clothing items to display, well, for instance, your heart and lungs in an artistic fashion without removing them from your chest cavity. If you wish to see what I'm talking about, go to www.arteryinc.com. That's INK, and use promo code LISTEN2PHP at checkout to receive 10% off any order over $35. And note that this excludes subscription boxes, though. And this will show your support for the show. And they're awesome business. All right, we'll go back to the show.
I think you should put that in all your discharge instructions.
Good. That's a
Please
great
keep
idea.
your organs inside your body.
Oh, I thought you meant an ad for Artery
And
Inc.
go to Artery Inc.
And
Yeah.
go to Artery Inc.
You guys should do that. Is that against hospital policy?
I don't think
I'm
so.
sure it is.
Not unless we're getting a cut. Guess if it's an
Technically
ad,
not.
we're getting-
Technically we are.
Not, actually. Well, I mean, yeah, in a way we are.
It's-
Anyway, let's jump right into Mike's Trivia Challenge, the former Mike's Mailbag. So this is where a listener sends us a question. We ask Mike, it's a medical history trivia question. We ask him if he knows the answer, and invariably he usually does not because these are extremely difficult. And you might say unfair, but if you stump Mike, you do win your own medical eponym that we will name after you. So, Mike, are you ready?
Ready.
Yeah, this one's
Freddie.
This one's kind of apropos, though. So this week's question is courtesy of Jessie, who's a fan of the show and happens to be a paramedic as well. And she asks the following. When was the first IO used on people, and where in the body did they place it? And let's say really quickly for somebody who's not familiar, an IO is an intraosseous line where you basically put a needle into the bone to get to the bone marrow so you can give fluids and medicines, much like you would placing something into a vein, except you can give a lot of volume pretty quickly this way. So once again, when was the first one used, and where did they place it on the body?
So the first one, I mean, this is easy. Was used in World War One.
Okay.
So I think it was within the first several weeks of the Ardennes campaign.
In the forest
in France.
Right.
So they'd run out of IV equipment, and so there was I think it was a frontline medic. His name was Robert Pattinson the third. So
his
he found
great grandchild went on to star in movies. Did he not?
Yeah. So they didn't have IV equipment, but they had all the saline bags because there was an explosion at a depot. Bringing stuff to the front line. So this Pattinson found a 22 casing because for some reason they were using 22 shells in combat.
The bullet. Yeah, it makes sense. Cheaper, they're smaller.
Yeah, so he bit off the end, attached the saline to it, and then he put it into the sternum, knowing that there's a healthy amount of marrow in the sternum. I know that I probably got at least one of these right.
Okay.
And that was the first IO. They were going to call it the Pattinson line, but he died shortly thereafter from the...
One thing I'm curious about in that answer, you're saying he bit apart a 22 casing and used the casing to drive into the sternum?
Casing. Yep, the casing was the delivery.
Makes more sense than the bullet.
Yeah, you couldn't use higher calibers because it would just it would infuse into the marrow too fast.
That's fair. No, that's fair.
22 is a perfect size.
Well, I don't think partial credit is a thing. It's either you get it all right or not.
But it's the sternum, isn't it?
It is the sternum. You were right about that. So the sternum, the breastbone, so to speak, right in the middle of your chest, was the first site. But here's the quick background. So 1940. So you weren't super far off there. We've been using IVs apparently since the 1830s or so, where you put fluids into a vein. But a physician, at least I think he was, it wasn't really clear from what I read, named Lavis Tocantis.
Sounds Frenchish. I'm two for five.
That. You're not. He theorized that the infusion into the bone marrow, if you were to be able to get a needle in there, would get medicines or fluids into the larger circulation. So it was theoretical at that point. And in that year, he decided, I'm going to go ahead and give it a try. And he placed a needle into the sternum of a female patient. He injected some mercury because why not? And then he observed it ending up in the deeper veins of the chest by basically proving the concept. Put something into the bone marrow.
Things you could inject. He wanted to see it under. Did he want to see it under X-ray or something? Is that why
I did? Mercury? I tried to get to the article. It was I
suppose he had to.
It wasn't even a paywall. It was just like a 404 error. This doesn't exist.
I want to know what the informed consent discussion was for that experiment.
Probably was.
He wanted to see. Yeah, she was giving him mixed
Show me.
signals. She was hot and cold.
I bet. I bet So the fun part was like the suggestion on how to do this back then. It was to basically take the needle and twist it into the mid sternum until, quote, it has a good foothold. And I presume that that's probably before you access the sidewall of the beating heart below it. So you don't want to go too far, but get it into the sternum. And then he ended up doing a trial on then 14 patients, including 2 children under the age of 1, because their boldness knows no bounds before modern times. And I should note there too that they didn't use sternums because he thought that might be a little sketchy in infants.
Glad he noticed.
Yeah, he used the proximal tibia and the distal femur, so like basically the above and below bones of your knee, and we still use those sites today. So this is one of our favorite ways in emergency medicine to get get circulatory access in the very sick patient immediately. So there you go.
Yeah, funny story. You can use the humerus now too.
Yeah, you can.
So,
definitely. I think I've used every site except for sternum. I have not used sternum, but I know
use
they
the
still
arm
do teach
bone.
it.
Have you used this? I haven't used the sternum.
No, I haven't.
I haven't used the femur either.
Usually it's
Use
just
the femur.
Tibial. Yeah, which is right below the knee. You can feel a nice flat
We have
part.
drills now that do this.
Mhm.
If you want a visual image,
It's not as unsettling as you think it would be.
It's still
No,
kind of
no.
unsettling.
Yeah.
I'm going to say, because I came up with an eponym that I read about an eponym that I thought was excellent and perfectly fitting. So, Mike, you get partial credit, but you need full credit in order to win. So,
Yeah, no, that was a great question.
I think it's a great question. So, I'll tell you what, I don't know. Have you guys ever heard of Jesse's paramedicose myohypertrophy syndrome?
No.
Yes.
Shut up. You have not.
Dr. Robert
It's-
Pattinson IV.
So what this is, you'll find if you read about in all the medical textbooks that have this, you will find that it's an excessive development and enlargement of the chest and upper arm muscles from frequent performance of CPR. And you'll typically see this in your EMS providers, nurses, and other first responders. It's a benign condition, and it basically represents being swole from repetition of endless chest compressions. And it's felt to be a desirable trait. Can't
Jacked.
believe you haven't heard of that.
Yeah. Well, I was, it's one of those things you don't want to comment on because you're not sure.
Once you become the physician, then you don't have that anymore because everybody else does that work for you.
resolves.
And
Because you're just standing in the corner of the room rolling your eyes. Ugh.
so a lot of thanks, Jesse.
I don't have to
love the
adhere
question.
to
Thank
ACLS
you for your
protocol.
question again. And if you would like to send us a trivia question to try to stump Mike, get your own medical eponym, do so through our website, through our social media pages, or by emailing us at poorhistorianspod@gmail.com.
Did you get that question on Threader or Threads? Is that the new?
No,
thing?
I actually got it emailed to me. All right. So, guys, you have no idea what we're talking about today.
No, zero
Is I-
idea.
None.
I've kept
Kind
it
of like
both in
going
the
to
dark.
work. It's kind of
I
like
just
going
wanted
to
to
work.
try this. Just see. I have brought together a case study that neither of these two have. They don't have any idea what I'm going to talk about here. And I'm going to give you the case. It's a real medical historical case. I'm going to leave out some of the details. We'll figure out who it
Typhoid
is. No.
Syphilis.
Ooh, Sisyphus.
Stab in the dark, but still no.
Stab in the
Galen.
dark. I love
You're just
it.
going to rule out everything?
Ooh,
first?
Step in the Dark. Oh, Jack the Ripper.
So here we go. So this, think of this like almost like a grand rounds case presentation, right? So here we have a 40-year-old man who's brought to the emergency room. And I won't tell you when this is. This is just in history for right now. So brought to the emergency room in early October for evaluation of lethargy and confusion. He was traveling from Richmond to Philadelphia, and he becomes ill and was found unconscious under the steps of the Baltimore Museum on Baltimore Street in the late afternoon. He was apparently well when he left Richmond at 7 a.m. There was no evidence of trauma, and he did not smell of alcohol. Other important things in his history, he apparently worked as a writer. He had no known allergies. He did not have any known coronary artery disease, aka heart disease, didn't have any diabetes, no other systemic illness as far as they were aware, was taking no medicines, and he had cholera 3 months before the current hospitalization. History of depression, maybe opiate abuse, not clear. maybe alcohol abuse, also not clear.
How do we know
but
all this? Is there like a super informed family member that comes in and tells us all these things?
Or is
I'm
this
just-
like common knowledge of society?
We are learning. This is a grand rounds case presentation. The case has happened. We have accumulated the info. So I'm just history. That's how we know it. We know
All
it
right.
because of history. Take a thorough history and you get all this.
I already know who
Aaron.
it is.
Uh-huh.
We'll just keep
We'll just keep.
with this game.
So
I was just contrasting it to normal when somebody just
Yeah.
throws a person on the gurney and they're like, here's the person. What happened?
Mhm.
I don't know. They said he was
that's real life. This
they
is
said
the
he was
post
okay
case.
yesterday. No,
So-
he's not.
So this person, again, maybe alcohol abuse history, but he had apparently abstained from drinking for at least the last 6 months. There was no reported history of seizures or delirium tremens, which is a severe form and life-threatening form of alcohol abuse. He did smoke tobacco on a regular basis because, it was way back when, and he was sexually active with women. There were no known pathologic work exposures. I don't know that you have a lot of those as a writer, but so you might stab yourself with a pen every once in a while.
I was thinking it was going to be like some sort of ink or dye toxicity or
Mhm.
paper
Okay, I like it.
binding toxicity.
So that's the
All right.
backstory. The hospital course is this gentleman.
Wait. Are we in the ER or are we in the hospital? Max?
That was the ER arrival. So
He
now
got
we're
admitted
moving to
'cause
the
he
hospital.
Wait, we
couldn't-
admitted
he-
somebody, but we don't even know why. We didn't even get to ask any questions about why we
I
would admit
always
this
know
guy.
the answer before I admit people to the hospital.
We didn't even get to do a workup. We didn't even get to evaluate
I'm
this
just
guy.
to tell you what happened, and then you have to try to figure out what you think the
After the
diagnosis
fact.
is. I'm
Okay,
saving you
all
a lot
right.
of work. I'm saving
Why
you a
no?
lot
You're
of
But,
work.
right,
let's,
you're
let all right, okay, all right, fair enough. So there's a guy who went unresponsive on a train ride and was on the steps.
He was found on the street.
In
So he had to
some-
get from the train to the street then. So he,
True.
yeah,
True,
yeah,
true.
okay.
so
Wait,
found-
in
how
October.
high up is the
In
train in
October.
relation to the street?
above it.
Is it an L in Chicago? Can he move his legs? Was he found on the ground?
Baltimore.
So bad.
Oh, you're right, Baltimore.
All right.
Okay. Hospital course. So he is admitted to the hospital for observation. Probably not under ob status. I hope not. He was initially unresponsive, and then he remained so until about 3 a.m. late into the morning, when he became tremulous, meaning shaky, seemed to be delirious, so like kind of not knowing where he is, a poor attention span, and then he appeared to be having visual hallucinations. Noted that he was drenched with perspiration. He had wide variations in his pulse rate, so his heart rate was going up and down.
Was there a
And-
binky?
Was he what?
Was there a binky?
Is there a binky?
Like a pacifier? That's what we call pacifiers when we have kids, Max. Was there a pacifier? No
That's a
pacifier?
We call them nooks.
This is a wait. Where are you getting
Binky or
pacifier?
Nook?
This is a
MDMA.
dude. Like this is a
MDMA. This is pre-MDMA.
oh yeah. This is way back. So
Next question would have been: is he covered in glitter? Is there any glow paint?
I wouldn't know about that sort of part of our culture.
Yeah.
Was he grinding his teeth?
Yeah. Me neither. I know nothing about that part of our culture either. I don't know anything about
It's not
clothing.
MDMA.
Okay.
He
Dang it.
remained in that state for about the next 28 hours. And early
Very
in the morning on
specific.
the
So he's
third hospital
delirious.
day,
Just
Yeah, so
delirious and
he's
visually
delirious.
hallucinatory.
Yep.
All right.
Yep.
Initially unresponsive. Okay.
does that for the next 28 hours. And then on the third hospital day, he became tranquil, as they put it, which I think would sedated. It's a nice way to say sedate.
Did he have a tamping rod in his head?
He did. No, he did not. So results of the physical exam showed a well-developed white male who was calm and appropriate. His skin was warm and diaphoretic, meaning sweaty. His pulse
Is
rate
this
was
when he
now in the
arrived?
This
Or this
is
is when he's
I think this is
tranquil?
during the hospital stay. That part is not clear from where I pulled this. His pulse rate is in the 50s and thready at this point. This is probably
Oh,
late in the
it's
hospital
slow.
stay. And results, so it's going slow. Results of the neurologic examination showed the patient was alert, oriented, and appropriate at that time. There was no tremor anymore, and he followed commands, again, appropriately. So kind of like in and out of it. He said he felt, quote, miserable, but denied any specific pain. He did complain of mild diffuse abdominal discomfort and headache, which seems contradictory as I read it. He had no recollection of how he had arrived at the hospital or any of the events leading up to the illness. So I guess poor memory there. And he's improving. So they transfer him to a regular kind of ward or floor room. And here his physicians apparently tried to treat him with alcohol, which he refused to drink. He soon worsened again, and by the evening of the third hospital day, his mental status is bad and clouded.
Wait,
was
did he take the alcohol or no?
He refused it.
He refused it. He refused it.
But I don't know if refusing during this day and age might be like,
Fair.
okay.
It's I
We can
was going to
presume
say,
he
I'll
did
tell you
not
it's not
take
important, but it
alcohol.
might be important. So I do not know. He was then having shallow but rapid respiration. So he's like breathing slightly and quickly, and kind of then becomes weak all over. He drank water, but he had great difficulty doing so. And by the late evening, he was again delirious and became combative. Then he needed restraint. He remained in that state, calling out for family, friends, and unfortunately then died on the fourth hospital day.
And you haven't mentioned any medicines or anything administered, so this is probably quite a while
Except
ago.
for
So I'm assuming the
alcohol, the
restraints are
attempted
just
Alcohol and
just like
restraints. We call that
chains.
brutane.
But we don't know that he took the alcohol.
Oh, we don't know that he took it. And there was no, from what I found, there was no other record of other medications.
Oh, and he's on the
Presumably,
eastern
they weren't
seaboard,
giving him a bunch of heavy metals for
He's
fun
on the
or
eastern
anything.
seaboard.
Eastern seaboard.
Interesting.
This is where I was going to ask you for a few differentials, meaning like ideas that you think it might have been.
Well, up there would be alcohol withdrawal. They can give you
Right.
delirium,
I think that's
visual
fair.
hallucinations.
That's fair.
Yeah.
They attempted to treat
True
that
delirium tremens.
with
yeah.
alcohol. So that would be the reason for giving him alcohol.
I think you're right on, Mike. I think that's probably the thought then. And hey, let's not knock it, because there are some places we still do that, right?
Oh, yeah.
I've ordered alcohol for
Absolutely.
patients in a hospital before.
Yeah,
'cause,
and if you got
sometimes it's what you got, and if you're withdrawing, you try to step them down slowly. It's
And
If
that was
this
the
were
only
during-
history we got. Well, you said he was sober for 6 months, so that would mean it would be unlikely that he would be
Right.
withdrawing, but there's a chance that he could have been untruthful with his sobriety.
patients are never untruthful to emergency doctors.
Right.
if this happens to be during Prohibition, he could have gotten his hands on some other kind of alcohol, so that would
Yeah.
Good question. Yeah, I like that.
Yeah, no, you said his breath didn't smell like alcohol, but did it smell at all?
There was no note of anything unusual.
No, like fruity odor? Because the other
Mm.
would be like diabetic ketoacidosis or toxic alcohol ingestion.
Yeah, maybe explain that a little bit. Why does your breath get all fruity smelling? To some people, not everybody.
Yeah, I can't smell it. I wish I could. Acetone, right? Isn't it?
Yeah, acetone, you become ketotic.
Yeah,
so your
so-
breath might smell sweet. And then isopropyl alcohol, I think, will also give you a sweet smelling breath.
Mm-hmm. You're absolutely right. Yep. So none of that. And I will note too that although those cases, that type of severe diabetes, and if you overdose on isopropyl alcohol, can produce ketones which show up in your breath, not everybody can smell them. I cannot. But there was once a case I had of isopropyl overdose that somebody walked in the room and said, "Why does it smell like ketones in here?" It's like, oh, we figured it out.
All right. So you got initial unresponsiveness, and then delirium, and then lucid period, and then death, essentially.
But a long lucid period. Like
It's
3
about a
days.
4-day course or so, I believe.
Yeah.
Opiate overdose is another, but you wouldn't
Well,
expect
it's
the
gonna be
course to be that long.
if you got delirium, right? So you could have a sedative withdrawal. So if you're on a downer medicine of many kinds, and then your body gets rid of that, it's kind of the same thing with alcohol. You can get delirious when your body is, when you metabolize it all and it's gone, then you have withdrawal. But talk seems less
Which,
likely.
if you're on downers,
So-
your withdrawal you expect will be something kind of
so you're gonna
agitated.
be
like
up,
you're
right? So
saying,
you'll be
yeah.
agitated.
Yeah, I feel like this
Um,
is kind of a tox case. I mean, the other would be a head injury. You know, if he's
Yeah, found
unresponsive
down
Some sort of
initially.
always.
trauma. Yep, trauma.
maybe
So if
he
you
had
had trauma,
a
I will say they didn't note any external signs of trauma, but we all know that's not always reliable.
yeah,
Yeah,
well,
he
that's a
could
good
have had
thought,
a
Mike. Right.
small
So if you had a little bit of bleeding in
subarachnoid.
the head,
Mhm.
right, a little bleeding, and it gradually expands, you would get delirious. You might have a lucid interval, and then the heart rate going down might represent increasing pressure
Yep,
from the
breathing
Inside
bleeding.
your brain case,
Yep.
inside
Shane
your
Stokes respirations.
skull case. Yep, and then that would
so
definitely
irregular
kill you.
respirations because of increasing pressure in your brain
You
case.
mentioned the cholera. So then there's a whole bunch of post-infectious sort of inflammatory things that occur with people. So you can get, I think you could get like an inflammation of the brain after a prior infection. You get inflammation around the heart from a prior infection. You can build up fluid around the heart from a prior infection.
Saw
I
a
don't
lot
know
of
if
those with
cholera
COVID.
does
You know,
those
that happens
things.
with COVID.
Yeah,
Mhm.
yeah.
Yeah, I don't-
Guillain-Barré.
Ooh,
Yep, you get a spinal weakness. You can't even
that's
walk.
a neurologic issue that can happen
Yep.
after
Yeah,
certain
it's
infections.
Which
progressive
goes from the
weakness.
feet up to eventually kills you because the diaphragm doesn't work, so you can't breathe.
Got a lot going on. Any other major categories you want to go? And then we'll go
Tox,
through.
sweaty organophosphates.
Well, I said autoimmune. I mean, yeah, just primary infection too, right? So this could have been a, Lyme's disease, Eastern Seaboard. Lyme's disease will cause like an infection around the brain, and then sometimes it'll cause a heart block. It'll cause the heart to go slow as well.
Interesting, like that.
Oh, foodborne stuff like seafood.
Yeah.
What am I thinking?
Thinking
foodborne stuff like infections.
Yeah,
that's true. And it used to be much more
the
poorly
one that
controlled.
But not usually deadly.
Yeah. Well, there's I'll have to come back to those.
Okay, so then not ingested tox, but also like environmental poisons. If this was anytime,
leave it to the ER docs to be like deep into the tox weeds, because it's such a big part of our practice.
Well, be unresponsive.
Yeah, of course. No, right.
I mean, fitting. And you got all the things that cause coma. So the initial coma presentation, thiamine depletion in this case could probably get severe enough. So if you don't have enough B12, you can get very confused.
Folate. Yeah, B1
is B1. I don't know. One of the Bs.
Pyridoxine is B6.
B6. Yeah.
Hey man, all I need to remember is thiamine. I don't got to teach about this anymore. So okay, one of the B vitamins, and then low blood sugar, super high blood sugar. Any of those during, but you wouldn't if your blood sugar is super low because of a tumor and not diabetes or either cause. You usually just progress pretty quickly to
it was generally low blood sugar is going
3 or 4 days.
It's going to cause a massive problem.
And then so delirium, so that 3 days of delirium, that, if you don't have a good handle on what's going on with the patient, that could be caused by something like a heart attack. I mean, you could have such a bad heart attack that you're just flopping around and feeling awful.
Because they don't mention any checking of blood pressure, so blood pressure.
I mean, it didn't sound like there were a lot of interventions
or maybe
at all.
Hypertensive crisis.
What about
they have super high blood pressure causing neurologic
there you
effect?
Go.
What about urine output? Did they say
right.
About
so it's kidney failure. So if you were in shock and
liver failure too.
I don't have that information, but it wasn't mentioned.
Do they have any information? What kind of hospital
they have the
is
information
this?
I relate to.
God, the problem is like what you presented is like the final common pathway for almost everything. You get delirious and you get sick and worse and more sick, and then you die. If you don't,
so I will say, just to summarize for the listener, kind of the major cases here. You're thinking tox. You're thinking some sort of
it sounds like
trauma. You're thinking
tox or infection.
Like. You're thinking neurologic problems, and so. All right. So I did not write this case. I actually took it from an actual case presentation. And so this was something that was given to a group of pathologists, or not pathologists, but like a general pathology conference in 1996. They did this big case conference. They gave the case exactly this way.
1996?
This was the conference was given in 1996. The case was not in 1996. So they do this in Baltimore, and they don't give the name of the patient because they wanted to see what physicians in the modern day would think of this case. And so the case was presented to that conference, and a Dr. R. Michael Benitez, a cardiologist in Baltimore, offered his opinion, which may be the prevailing one, which we'll talk about. And there are basically, numerous possibilities. So we're going to break it down.
Wait, do we get to ask more questions, or are we're
going to
done?
We're done with that part.
We didn't even get.
Well, what do you guys think? All right. So what do you put your nickel down?
Need more information.
You're not going to get it. So you get to pick what you think is most likely. This guy and that cardiologist made a assessment based off that, and it's going to be incomplete. We don't know all the information.
Well, yeah, but you have a group of people, and everybody says something different. One of you is probably going to be.
I
right.
think it's late renal failure from the prior cholera, and that's why the patient was delirious, because the waste products of the kidney, one of them is. It's uremia, so that causes confusion. And then as it worsened over time, because they weren't supporting it, the patient got, I don't know why they got lucid, but they got a slow heart rate because their potassium was slowly building up, and potassium slows the heart rate down. And then eventually everything got so bad that they couldn't go on, and the potassium level stopped the heart. That's
very plausible. Very plausible.
That's my nickel. I'm going to put my
nickel.
I'm going to go with liver failure, prior history of alcoholism. He's got...
It's a good one. It's classic.
Yeah, he's got liver failure, so he's going to have a coagulopathy, so he's going to bleed very easily. Minor trauma, falling out of the train, ultimately dies of a head bleed, secondary to liver failure.
All right, like it. So, well, let's go to the next question. Do you guys have a suspicion on who this is?
I wrote down.
You want me to tell you the year?
No, well, I wrote down Edgar Allan Poe, and I don't know why. He might have actually
Winston
killed
Churchill.
himself.
Mike is right.
Edgar
It is
Allan Poe.
Edgar
I told
Allan
you, right?
Poe.
When it
He's a
said,
writer.
like, I was like, I know
he's
who
a
this
writer.
is.
He's a writer. Yeah.
He's a writer, and he's from
not
New
Hemingway.
England. Yeah.
No. This is Edgar Allan Poe. This is the story.
Do I get a point for that?
I give you a point. Yeah, I will give you credit for that. That's a good catch.
Wait, here,
so,
look.
you wrote yourself a... Okay, I see that you wrote it, Mike. I believe you.
Nice job, Mike.
He did write it. He showed me on the camera, everybody. So,
Nice.
great. The kind of fun
Impressed.
part about this is I think this also gives our general listener kind of a little peek behind how the process works when we have something like this. We do actually gather up when we have difficult cases. We don't have complete information, and you start thinking about possibilities. So I thought it might be fun to kind of do this and actually take this case, which I'm going to tell you, they have a strong suspicion of what they think based on this. We'll get to it, but we don't know for sure because there was no autopsy ever done. And so this is kind of a fun medical detective mystery, so to speak. And so, yeah, we were talking about Edgar Allan Poe, and as much as I wanted to save this for like a Halloween kind of thing, it's just as good a time as any to discuss such a cool story. So
If you had told me the patient buried his heart under the floor, then I would have known.
That's
but
why I didn't tell you that. Absolutely why I didn't tell you that. So
Jerk.
now
And
that you know who
can
it
I
is-
just say something real quick?
Yeah, go ahead.
We have two English majors
I
in
know.
the room.
I was
and
gonna
then
say,
the
I'm actually
biology
very
major-
embarrassed. I'm very embarrassed right now. I'm very
Knew you were
embarrassed.
there.
All right. So
I'm
a little
just
bit.
sitting in my shame.
You're even wearing the Edgar Allan Poe T-shirt.
I am not. It's
Oh.
it's a treehouse. It's not a.
The
And
little
Mike's-
background on old Edgar here. So Edgar Allan Poe was born in Boston, 1806. Did a bit of writing in his life, as you may know. He also spells his middle name with an A in Allan, like Allan, and I thought that was weird. So I'm noting it here.
I spelled it wrong.
I did too. That's why.
I get it.
So, nevertheless, Poe is a huge figure in American literature, of course. He's associated with macabre fiction, and some actually consider him to be like the founder of the detective genre, which is pretty cool. He's a notable short story writer and poet, but have you even read and appreciated his literary criticism, Aaron?
No.
Doesn't
I
sound like
haven't.
he has.
No. Who is this guy? I sound suspect.
Poe, is that the guy from Kung Fu Panda?
Poe. Wasn't he one of the Teletubbies?
No. Oh, yeah, he was. Oh, you know that, Aaron.
He's the mauve one. My inner English major literary critic and like pedantic self would point out that his fiction, though it's definitely iconic, is like really formulaic in its execution. But that doesn't matter because he totally nailed it as far as creating a whole mood of writing that young, angsty me and all my fellow English major nerdy goth friends will always have a fond place for him, and especially for the Raven, the Telltale
He just
Heart,
comes for people. He's like,
yeah.
Poe ain't all that. You know what else sucks? Poetry. All of it.
Is that why they call it poetry? Because of him?
Oh,
Not at all.
Oh.
How? But it's this stuff was just good. I mean, it was just good. It just hits you in the right spot, and how could it not? Because this guy is like the child of two actors, making him like the ultimate theater kid. Notably, his father abandoned the family when when Poe was 4 years old, and his mother died from tuberculosis when he was 5 years old. So it's a kind of a rough start, to be fair. An uncle ultimately raised him and gave him the official name Edgar Allan Poe. I guess before he just had the first and last name, but he would have just been Edgar Poe. And hello, my name is Ed Poe. Just wouldn't carry the same literary weight.
He didn't use a pen name?
You gotta have three names.
How do you know it's not a pen name?
I mean, because the history book said it
Wikipedia?
wasn't.
Oh, okay.
I don't know. Many people also know some of the salacious things about old Edgar, like marrying his 13-year-old cousin, which it's a different time, but still feels really skeezy.
I did not know that.
Oh, you didn't know that? Oh, yeah.
No.
He dallied around in some college. He went to the University of Virginia. He eventually even ended up dropping out of West Point, so he could pursue writing. And rest is, as they say, history.
And his cousin.
Yeah, I don't love that part. So here's the actual historical account of his demise, right? So this takes place on September 27th, 1849. Edgar Allan Poe goes from Richmond, Virginia. He's going to Philadelphia, where he was supposed to arrive to critique the poetry of Marguerite St. Leon Laud, who is a writer who has 4 names and punctuation within their name and writes poetry, which is basically a statement of fact that's a joke in and of itself. He takes the train, which passes through Baltimore. He was supposed to continue on to New York. I don't know if that's New York City or just somewhere in New York State, after all of that super difficult poetry critiquing. But he did not make it because of dying in Baltimore.
How do they know back then, too? It's like, where's Edgar? Oh.
Well, I mean, it's kind of...
Just
we'll
find his
get into
phone.
it.
Just find his phone. It's right there.
Oh,
you don't have
Not
the app?
returning my
Oh.
he's in a
letters.
hospital in Baltimore.
Oh, no.
Look up my chart. What's a CT show?
So in his personal life, aside from having a creepy, if not criminal marriage, Poe has been described as having an on and off relationship with laudanum, an opium and alcohol mixture, which is pretty popular at the time.
Yeah, in his defense, right? They just said, this makes you feel better in all ways, right?
I mean, yeah. I mean,
Tincture of
many people
opioid,
did.
and what do they put in, like alcohol too, don't they? Isn't it like alcohol
Yeah, it's
laced with
I believe
opioids?
it's the alcohol suspension. You could
A
like use it with
downer,
a dropper.
downer. Yeah.
Well, it's like if you ever watched the series Deadwood, and you definitely should have because
Oh,
it's
I love
amazing. It was on HBO, I believe. You'll be really kind of familiar with like that medication in that time period, and like the abuse potential, and you'll also like be totally benumbed to lots of old West swearing because it's just
and then
so much swearing.
urologic procedures too. You remember the scene? There was a kidney stone removal.
Yeah, yeah.
But then it's like, God, why do they put that in all? Because I think they might have done that in the Nick too. Like late 1800s kidney stone removal is like the thing to show.
Yeah.
Maybe just because it's
kind of
disgusting.
brutal.
Yeah.
Yeah. No, bad. Do not want. Modern medicine's better in that respect. So there's also sort of this kind of maybe he was a drinker, and this kind of goes back and forth apparently historically. So there was not anything that really suggested a heavy alcohol use, but maybe he had a particular sensitivity to alcohol that apparently his sister had as well. So like if he had a small amount, he would appear really intoxicated and like be very kind of described as violently ill, like even one drink. And so for some reason he would do that on occasion anyway. And then
Maybe he was an auto fermenter.
Well, that's a couple of things I was going to say. Like, there's certain conditions where, some people do make kind of
They
alcohol.
can turn
out
sugar
of,
into alcohol. Yeah.
Yeah, in their stomach. And there's also like alcohol dehydrogenase deficiency where you don't have an enzyme that helps you break down alcohol in your stomach. And then you can basically, one drink is like getting crazy wasted, but like feeling really bad about it because you get a lot of byproducts and stuff. So, but, before he died, he had actually joined the Sons of Temperance movement. About 6 months before he died, and they weren't like known for wild parties or anything. So maybe he was sober. How do you know for sure?
Yeah, but you never know. Maybe he's like a public figure. I'm going to join this thing because everyone talks about how I drink too much, and I'm going to join the Sons of Temperance to show the world that I'm
He
sober.
hired a PR
but you're
firm
really,
about 8 months
Right.
ago. They're like, you know what
He's
you
just
need to do? You need
drinking
to clean
his
up your
face off.
your image.
Yeah.
once you have that Sons of Temperance card, you are good to go.
Is it like the Knights Templar?
Yeah.
It's exactly
No,
like that.
I don't think
Except
so.
not in any way. But
the other book I read is Dan Brown's Da Vinci Code.
oh, okay.
But I didn't
Fair.
finish
Two
it.
books.
I listened to
One
I
of
read
two
half
books
of it.
read.
Yeah, I don't want to add another book. Yeah,
What was the
listened
other
to
book
half
you
of
ever
it.
read?
The Andromeda Strain by Michael Crichton. I didn't finish that one either. I
Now
got to the
you're a
point where they
doctor.
got to the jungle, and then I was like, whatever.
He's not always good at ending books anyway, to be fair. So Poe arrives in Baltimore on September 27th, as I mentioned, but he actually goes missing for a week. So
Aw,
nobody sees him.
Super
He just
sketch.
gets off the train and he's like gone for a week. And so
He went
the
on a
events we talked about where
bender.
he's found in the gutter, etc., that all happens on October 3rd, 1 week after. And this is again 1849. So this dude named James Walker is like just standing there on the street, and he's like, "Hey, look at that guy in the gutter. He's all disheveled." And I saw this in like multiple articles, like ill-fitting clothing. They were just like, "He had ill-fitting clothing. It didn't belong to him," which I don't know how they figured out that wasn't his. Whatever.
Could have been the
So
style, right? Remember, like from the
It was
early
his-
1900s.
It was his cousins.
everybody remarked on, so maybe not. But James Walker's standing there, and he's like, "Hey, look at that guy!" And he happens to recognize him. He's like, "I know. Oh, that's Edgar Allan Poe." So I guess he knew
from the
who it was.
lithographs.
guessing so.
Wait, can we just sidebar on how classic a story this is? That somebody gets sent in by a good Samaritan passerby? Because this happens all the time. You have somebody that's on a park bench or looks rough, and
Yep.
it's a good Samaritan calls EMS. That's like which is good. You want people to do that, except sometimes, if it's somebody that you see every other day, you wish.
And they're sleeping in the park because
they're just sleeping. They're just sleeping on the park bench.
Yeah, they do the Lando Calrissian like nod, like, "Hey, I know you," and then you're like Luke or Han Solo, and you're like, "Hey, I know you," and then you just part ways.
Yeah, that's fair. I mean, hey, you see somebody down on the ground, it's fine to ask for help. There's no fault in that.
This is not a medical advice podcast.
This is also the alternative to the like people who bring in somebody and like dump them in the waiting room and then take off. So it's a different way of arriving.
There's a whole bunch of inappropriate ways to talk about that method of conveyance.
Walker says, like I said, he's like, "Oh, I know this guy. I'm gonna get him to the hospital," and so he takes him to the hospital, and he's like, and they actually wrote this like he's gonna send for help, and so he sends a letter.
Oh my! Maybe the mail was
he takes
more
him to the hospital,
then.
but he sends for help. So he's able to talk to Poe, and Poe, in bad shape and not making any sense, tells him the name Snodgrass. And so even though Poe was like altered in like whatever stupor, that's actually a real name. It was a name for Joseph Snodgrass, who may have been a physician, some of the articles suggested, but he was also Edgar Allan Poe's magazine editor. And
so you think he was asking for Snodgrass? Like Snodgrass should help him?
It's sort of like Walker's saying, like, who do you know in the area? Do you know somebody in the area? And like he just gives him this name. And so I don't know exactly how he figures it out. So he dispatches the letter with haste, like no 911. So I guess you send a letter quickly.
What's his address, Edgar? Snodgrass. Wow. Just write Snodgrass on the envelope.
You give it to the mailman, he'll figure it out.
Yeah.
So this is the letter he actually sent. This was, again, sent on October 3rd. Dear sir, there is a gentleman, rather the worse for wear, at Ryan's 4th Ward Polls, who goes under the cognomen of Edgar A. Poe, and who appears in great distress. And he says he is acquainted with you. He is in need of immediate assistance. Yours in haste. Joseph W. Walker.
What's Snodgrass going to do? You said Snodgrass is a doctor, or he's
he
an
actually
editor?
addressed
We
it
don't
to
know.
him as Dr. J.E. Snodgrass. So one article said that he had medical background, but didn't say he was. I don't know what that means.
No other doctors in Baltimore.
Well, I've got my doctorate, but
So Edgar Allan Poe's in the hospital, and we talked about the case, so I won't go back through all that. But
he didn't mail it from the gutter. He mailed it.
No, I'm guessing he gets him to the hospital and like in haste writes the letter and sends it. So, I mean, what else can you do in that day? Send a pigeon?
I mean, he's just walking around finding dudes in gutters.
You find you find a kid in the street and offer a farthing to go find somebody,
and then the kid jumps on his penny farthing and then rides down the street.
Whatever money was back then, I don't even know.
Yeah, shillings or something. So he's in the hospital. We talked about that case. So we won't go back through that, but we'll kind of talk about some of the leading theories. You guys hit all the main ones. So like trauma or assault, right? So you find a guy disheveled and altered in a gutter, and it could certainly be trauma. It's as true today as it was in 1849. One theory was that he could have been the victim of in the words of the article, ruffians of the streets of Philadelphia. And, today those ruffians are known as the two dudes who roam around the streets and cause all sorts of trauma on unsuspecting innocent people who are definitely minding their own business when two dudes came out of nowhere. And it's always two dudes. Someday they're going to find those two dudes, but there's been a lot of mayhem. So none of the accounts, including the actual, I took that case presentation right from what they gave, but nobody comments on any external trauma. But we said it doesn't, you can get punched in the liver or spleen and bleed, and internally, and you may not see obvious signs of trauma unless you're really looking, and so it doesn't quite rule it out. There's also a fun side story where a book was positing that Poe was maybe murdered by brothers of the family of his wealthy fiancée, a Sarah Elmira Shelton, who is somebody different than the 13-year-old cousin that he was previously married to. I don't know where this story goes. It's weird. So he was married, and then he finds this fiancée, I guess, who was of age or whatever, and their family was not happy. I don't know.
Jill,
Didn't get into those
15-year-old cousin, the older
Yeah.
cousin. Like, how dare you?
Second cousin.
Could have
this
been
time.
poison. A lot of poisons will take a while to take effect. Certainly
Yeah,
could have been
true.
poison.
We're gonna get there, but anyway, so this author thought maybe the family was late. The brothers of this person were like, we don't want you to marry her, so they murdered him in Baltimore by like making him drink or something. It's salacious, but did not find a lot of people that thought that this was really the story.
Did they do like an autopsy or anything?
No
said
autopsy
no.
was ever performed, so that's
All
part
we
of
have
the
Because of the
history
time or because of
Did they know how to do
What was the
autopsies
reason?
back then? Yes, they did.
I'm
All the
sure
way back
they
to
did.
Vesalius.
no,
They
no,
knew
no,
how to do
like
autopsies.
not the time. Like the time being, would we do an autopsy on somebody like this that ended up dying?
Great question. I don't know why it wasn't done. Everybody laments it in these articles, which I agree. I would want
Well,
to know.
there are articles
but,
trying to find out why he died, but
Yeah,
maybe
of
it's
course.
none of your damn business.
Yeah, take that article, Raiders.
What's he gonna
Um,
do? There's no like the only people that would really care would be the criminal justice system and potentially his like offspring, if it were
Yep.
to be something genetic or whatever. But they wouldn't even know what genes are then.
Yeah, they don't know it. Yeah, you're right. You're thinking it through, but yeah, you're right. So, alcohol or substance related questions, right? So, like kind of in the tox realm, we mentioned that Poe had an intermittent relationship with alcohol, and it's like this sort of described as an on and off issue. It's not like a large amount of alcohol at a time, but this weird intolerance thing. And people would say he'd become violently ill. He'd go out and have like a drink and then like be in really bad shape. Some of these articles suggested maybe he could have had a little bit more than usual, and that was enough to like cause this. I don't know. Over 4 days, having this weird delirium. Alcohol, once you have it in your system and you don't have any more. Granted, I guess the docs were giving him some, so fair there. But it's not gonna. If you stop drinking at a certain point and you're conscious and breathing, or at least even if you're unconscious but you're still breathing, it will just get metabolized away and you will eventually wake up.
Yeah, you're not going to
unless
get
you
re-drunk.
add something else to the mix. Yeah,
Yeah,
exactly,
it's gonna kill you around day 3, right? When you have the super high
Right.
blood
Mhm.
pressure
And I'm not aware of anybody
hallucinations.
with those type of sensitivities that it's not like a lot of reports that like they can have enough alcohol to cause true harm. Like alcohol dehydrogenase, they usually feel so bad they just don't drink anymore. And folks who do unfortunately die from what was kind of commonly called alcohol poisoning, usually it's a lot of alcohol at once to the point where honestly your body stops making sugar because it's got so much alcohol on board, which is kind of an interesting pathophysiology. But nevertheless, it has to be a very large amount, and generally speaking you are found down and you don't get back up.
Mhm.
I would
But
just-
those
yeah,
people
that-
don't usually drink that much because you get the bad physical effects before you ever get like the
Exactly.
euphoria.
Yeah.
Yeah, exactly.
So you don't have that
Exactly.
positive feedback like, oh, this is something I want to do again.
It's also true. I've never ever heard a severe chronic alcoholic say they only had 1 or 2 drinks, and
He
they
could be a
must
liar.
have
Well, they've
somehow
always
gotten
had
some
2
extra
beers.
alcohol in their blood,
Yeah.
and they want to know where that alcohol came from. So that's the other possibility. I
Sure.
get really sick with alcohol. I only ever have a little bit. You're like,
I love it when people when you tell them what their blood alcohol level is and they're like,
they're like,
and then they
"That's
still try to
impossible."
confabulate. Yeah. No, it was mouthwash. I rinsed, I swallowed a little bit, and I swear to God. A lot of people
Yep.
swear to God.
we get lied to a lot in our job. So also, mixing alcohol with laudanum or opiates, that would certainly is super dangerous, can definitely kill somebody, but usually you're going to find that person not breathing and they're unfortunately dead on arrival. They're deceased when you come upon them. It's not a 4-day course where it's an in and out sort of thing, right? So that does not seem to be the case. They also, I should note that the theory of like this was alcohol related was perpetuated by the Snodgrass guy, the editor. Snodgrass was a member
Snodgrass
of the
did it.
I'm not saying he did it, but he was a member of the temperance movement, and he was one kind of like spreading the story. It sounds like that binge
Oh.
drinking was at play. There's some like maybe he had like some like sort of self-righteous interest in doing so. It did lead to them doing some forensics, like and I don't remember when this was done, if it was like contemporary or it was done later, but they were able to get some of Poe's hair and test it for heavy metals. The reason being that a lot of
Oh.
wine and a lot of the common drinks were they had a lot of like heavy metals
lead,
in
right?
them.
Lead, and
Yeah,
arsenic,
because of like
and stuff.
preservatives and stuff. So, but there really wasn't a significant amount. So it seems probably pretty unlikely. And so, yeah, like Snodgrass was using this maybe as a self-promotional, like self-righteous thing, which is
Or for the
not cool.
movement. like use
Possibly.
him
Yeah, exactly.
as
Well,
the tip of the spear for the temperance movement.
ooh, one category you guys did not get. Did you consider voter fraud?
What?
So
I guess he's wearing ill-fitting clothes. He's posing as
that
somebody
well,
that lives in
so
Baltimore.
so kind of maybe this is more a subset of the trauma assault theory, but he could have been a victim of a practice called cooping, which was apparently a thing. I guess Philadelphia politics were pretty rough.
Wait, it's
back then.
Baltimore. It's Baltimore.
Oh, that's right. It is Baltimore. My apologies. So Baltimore,
They
or
both may
just
have
politics in general. I mean, Tammany Hall in New York and all that, pretty rough. And so they apparently would have roving gangs, whether they're ruffians or not ruffians, that would kidnap people, basically force them to vote, get them drunk in between, make them change clothes, pretend to be somebody else, like use an alias, go vote again, and be threatened with like violence or harm. And so there's a theory that maybe one of these gangs got a hold of him, kept making him drink alcohol. He's got the sensitivity. Maybe that was enough, under
Wait, what
threat.
does the alcohol have to do with voting?
Why
Well,
do they? Why do they
Yeah.
get you drunk in
Honestly,
do this or
between?
we're gonna
I
beat the crap out of you.
Why
Okay,
they just
do it
threaten
again.
you with force and make you change your
one
clothes?
one
I feel
article
like that's
suggested
enough.
it was kind of more of a threat. The other article suggested more of a reward. Come on, come
Oh,
back
yeah,
and get
yeah.
a shot.
Oh,
You vote
yeah, yeah.
again.
That makes more sense.
I don't know. So, interestingly, this is actually a pretty leading theory. This is like a top 3 theory. I guess it was
the
fairly
fake
prevalent.
voting one. Was there like was
And
an
I
election
think
going on that day, or
There was actually. This was
okay.
he was found
It's a
outside a
top 3
polling
theory.
station on election day.
Oh,
And
okay.
so I don't know. I didn't have it on my list either. I got to be honest. And so,
How could I have missed that? It's so obvious.
Well, I mean, that's not a medical thing, Max.
but it's fun. Brain tumor. So Aaron, you
Sure,
kind of mentioned
yeah.
this a little bit, but this was another one, and I think this theory has my favorite description of supporting evidence, not because I think it's true, but because it's kind of got this like dark naked gun flair to it, like the comedy, like slapstick. I'll describe. So, 23 years after Poe
Surely
dies,
you can't be serious.
Don't call me Shirley.
I am serious. Don't call me Shirley.
When they dig up the coffin and they lift it up, apparently the coffin falls apart and like parts of Poe go flying
Nice.
everywhere.
Ooh, how
That's
long
good.
I
after
should
he
laugh
died?
at that, but it's. I mean, the image of anyway.
I'm gonna write
Were
a
they
book called
digging him up
Parts
to
of
try to
Poe.
figure out why?
Well, so one of the people who was part of this commented that I guess when the skull hit the ground or it rolled out of the coffin, he thought he heard something rolling around in it, and like
Oh
the first thing
my
that comes to my head was
God.
like a maraca. I don't know, maraca.
Was there a
like,
golf course nearby? Did he get hit in the head with a golf ball and it stuck
don't-
inside there?
They didn't comment. It was not given.
Mm.
But so newspapers of the time commented on this, like something was rolling around inside his skull, and they said it's probably his brain. And it's like, no, 23 years, your brain is, especially if the coffin was so rotten that it fell apart, your brain is long gone. But a calcified tumor, where calcium has deposited on the tumor, could definitely actually leave basically a rock inside a skull.
So they
And
could differentiate the sound of an empty skull rolling on the ground versus an empty skull with something in it rolling on the ground.
Nobody said they picked it up and shook it. It's just they heard something rolling
they
around
shoulda shook
inside.
it.
I know. Well,
like a
or
Magic 8
opened it
Ball?
up. I mean, I would have wanted to open it up, but I'm kind of a weird guy.
You just exhumed it. I think you could probably cut the skull open without
They
doing
might
too
have been
much more
afraid.
damage.
I mean, it's Edgar Allan Poe. They might have thought like it's cursed or
Fair.
something.
Fair.
Why were they pulling it out of the ground anyway?
Well, okay, great question. So they were going to put a statue at the site, and they wanted to move.
They forgot
him.
what he looked like.
Yeah.
He
So
looks
they
a
wanted-
lot
they-
bonier than I remember.
They were going to put a memorial there, and so 23 years after he dies, they were like, "Let's put a nice
Sit
statue
up,
here," and they were going to
Edgar.
move him to a different area, but
Like
You
a different
didn't work
polling
very
station.
well.
He voted again, actually, for 23 years.
Possibly. So I don't know. I don't know that a
Only in
brain tumor can
Arizona,
explain
Mike,
a
only
lot
in
of this.
Arizona.
You get a tumor that it occupies space in the brain. It can get big enough to cause swelling and all kinds of weird stuff. People can hallucinate. They can act strangely.
Seizures, yeah.
They can have
could have been
seizures. So I
seizures
don't
for
think
days.
it's super far fetched.
No, seizures for days, and then he wakes up, but he's had too much. I think, I don't know.
I don't think you can rule it out based on what we have here, but it's probably a top 4 theory of that. How about let's go to the infectious stuff. So flu, right? They listed his official diagnosis as phrenitis, like PHREN-itis,
Like-
and phren means mind, so that's like minditis, mind swelling,
Like
inflammation.
encephalitis.
Yeah, so I want to write that. I want to write phrenitis in a chart someday. But yeah, we don't use this term anymore. Today we would refer to it as like encephalitis or meningitis. Like encephalitis being swelling of the brain, and
Or brain
meningitis being
infection.
or like from brain infection.
No, just
or,
itis, right? Is inflammation.
Yeah,
right?
so itis, swelling. And so if you got encephalitis, the brain itself is involved in the swelling. If you've got meningitis, it's just the lining and covering of the brain. A lot of times you can have both, and you can use the big word meningoencephalitis, and that's a bad thing. It's generally a bad thing when your brain and the lining are all swollen, because it can be due to infection, usually viral or bacterial. There are other things that are non-infectious that can certainly cause it, but you're going to get somebody who's confused and altered and might be acting kind of normally at one point, but then not again. A lot of times you're going to find fever with this, and unusual behavior, sleepiness. So it could fit. You can definitely get seizures from it, right? So I don't know. That
Sure. I mean, there were forms of brain infection back then which could, easily make you super sick very quickly. So he easily
Absolutely.
could have gotten sick within the course of a train ride. They're still around, obviously, but
yeah, I mean,
with
influenza.
vaccines, they're less common, right? But we could have.
If it was from a train ride, you'd expect other.
He just got sick on the train ride.
Casualties.
What if you got all confused and sick on the train ride and you had brain inflammation? You might accidentally get off, or
Mhm.
It might not even know where you are. If people get confused, that would make sense.
Yeah. Oh no, and you're right. I mean, so like influenza can definitely cause it. Bacterial meningitis, it's infection of the brain. Herpetic herpes infection of the brain definitely is a thing that still happens.
You think a cold
You have
sore is
weird
bad on your
mosquito-borne
lip?
things. West Nile virus causes encephalitis, and a lot of people can get it, but only a few people might get.
Wasn't
the
there malaria
encephalitis.
in the United States back then too? I mean,
Yeah, in the
Don't
South,
don't
probably.
remember.
Yeah.
Yeah, I don't remember.
It
if
wouldn't be
was
in
then.
Maryland.
No, it's not far south enough.
Stupid.
Please,
Of course, there's no malaria in Maryland.
resign yourself.
Can
from
we
the show.
mute Aaron's mic?
This is embarrassing, frankly.
How could he say that? Didn't even know it was Poe. Good Lord.
So, October is when this happens, right? So it's kind of beginning of flu season. So maybe
Yeah.
that fits.
It's 20 years
Um,
too soon for the bad flu.
Possibly. And here's some other interesting facts. So this was not given in that case presentation, not because I was being sneaky, but just literally I took it from their actual presentation. They didn't mention it, but there were some reports that before he left for Philadelphia, in Richmond, where he lived, he did visit his doctor complaining of illness, and like his fiance at the time said he's pretty sick, he shouldn't go. And his doctor said, yeah, you probably shouldn't go. So they were trying to talk him out of it, and I'm sure they were both really worried about ruffians as well. Yeah, but he's pressed on, and so he went anyway. So if he did have influenza, pneumonia, or it became like a pneumonia, and he got like septic and really sick or something like that, then yeah, you could get a high
I mean,
fever.
yeah. Any bad
and-
infection can make you confused. So
I will
but why
say
did he end up in somebody else's clothes?
that
that-
I'll tell you, they
the
all
polling
mentioned that.
place.
And I just like they're really hung up on it.
Why?
I don't know why.
Maybe they were
Well,
his.
because it doesn't make any sense. You're
Well,
like, well,
so this-
something must have happened. That just
This guy identified him, so maybe
strongly
he
suggests.
maybe he brought baggy clothes with him to pretend like he wasn't Edgar Allan Poe.
He was wearing Jinkos.
Was he so swollen that they were his clothes and they just said they were ill-fitting because he was?
I
Maybe
think
he
they
They
had-
made it
maybe he had
seem loose.
dropsy.
Yeah, they made it seem loose.
Was his skateboard broken? If he was wearing Jinko jeans, or
Did you guys ever wear Jinkos?
no?
Were you too old for that?
No,
I had Jinkos.
I did not have Jinkos.
They're very comfortable.
I don't even know what Jinkos are.
They're the jeans that look like denim dresses.
They're like huge legged
Super
jeans.
long.
No,
They weren't
wide.
super long. They would like they're so wide they go way over your shoes. You're gonna Google it, aren't you?
Just
Yes.
doing it right now.
Trust me, they were pretty cool. If you grew up in the '90s,
Oh, those are awesome.
right?
You had to wear them with like a
Oh my
riveted
God.
belt.
We were
I
like
want
right
some of
before the
those.
pandemic. Yeah,
Look at
well, hey, right
those
before the
things.
pandemic hit, myself and a bunch of friends were going to buy some Jinkos off like eBay and then go out and have like '90s night at the bars. And then the pandemic hit, so maybe it was trying to tell us it was a bad idea. We can
That's a
still
bad
do it.
idea.
There's no
Google
law
says
against it.
Jinko jeans are back.
Yeah, they're awesome. The most comfortable ever. Just don't get them
Oh,
wet because once
man.
the water like comes up the jeans and they go to the ground.
You're a host.
I
What's
digress.
the name of
Not-
that? That's like a physical, phenomenon, right? That the water works its way up the.
So
Maybe
Anyway.
John Wick killed him.
returning to
Cavalry
the
action.
returning to the medical conference, I told you there was that cardiologist Benitez, and he put forward what it seems to be generally believed to be the explanation. I don't think either of you guys mentioned it. Rabies.
We're not as smart
Oh,
as the
I was going to say
cardiologists.
rabies. Did you say
Oh.
rabies?
Rabies.
I was gonna-
Rabies.
no, you didn't give enough.
So here's where they get that. Now, there was no known animal encounter in the story, right? But we all know that's there's not always, you don't always know,
Nope.
you know,
Could have
especially
been a long time ago. Could have been a bite.
correct. You can get an exposure or bitten by an animal. It can take up to a year before you actually develop rabies. So who, you know, you're never,
Yep.
unless somebody was like, hey, I got bit by a bat a year ago, you know, okay, that's probably important if you show up with rabies, but most people don't feel bat bites. You wait, if you visit us in the Midwest here and you wake up in a cabin and there's a bat in the room and you come see one of your friendly ER doctor, we're going to recommend rabies prophylaxis because you can have bites that we don't see and you may not feel them because like some have like an anesthetic to them. And, you know, I love sitting on my porch and watching the bats fly near my house. It's like really fun, but I don't invite them inside because like rabies is super scary and I do not want. And so who knows? He could have had that kind of exposure. The other thing I mentioned, it's so slow that, you know, it just, if you get bitten in a finger, let's say, the virus starts going through that wound. It tries to make its way into your nervous system. It follows the nerve all the way to your spinal cord, eventually your brain, but it's super slow. It can take up to a year.
Shouldn't they have recognized this though?
It wasn't rabies.
They have
Guys, Benitez
rabies.
is wrong.
And why did he get lucid?
Where's the hydrophobia?
Oh, great question. So the hydrophobia, meaning the fear of water.
Is that maybe him saying he
So
doesn't
now
want
there
alcohol?
was the report. They didn't frame it this way, but there was a report that he was having difficulty taking water. I read that as he just didn't want it. It's hard to drink fluids because he was like really sick. But it's possible that was people with rabies. Their throat becomes like super spasmodic, and they like any swallowing is extremely painful. So that's why you hear about like animals frothing at the mouth because they can't swallow their saliva. It's so painful, and they become like almost afraid of fluids because even trying to swallow them is awful.
The physicians of the day would have known that. They would have recognized that.
You would think so, but apparently they didn't write that down. They said phrenitis.
I know, because that's
which
not what it
rabies
was.
does cause a inflammation of the brain, like an encephalitis. So
This
there you
guy,
go.
He just stands up at this conference. He's like, it was rabies. And he just leaves.
I'd also like to point out that even though it probably would be its own episode, even with modern medicine, the first person to survive rabies basically did so in 2004.
That's a good episode.
Milwaukee
We should do that one.
So we
should do
treat
that one.
with
That's a
what's
great
called
one.
the Milwaukee Protocol. We'll save the rest of that story for a full episode. But,
There's even a really good NPR episode about it too.
Oh, definitely. And hey, look, Milwaukee brought you Pabst and survival from rabies, so you're all welcome.
Yeah.
There you go.
Yeah.
It wasn't rabies.
And Schlitz.
Here's the
Pabst
list
and
of symptoms
Schlitz.
that they think
And
kind
hams.
of
Hams.
fits. Okay.
And
Hams is
PBR.
delicious. I like both. Poe
Miller
had...
High Life.
You're just naming beers.
Miller
I know
Low
they're all
Life.
from here. So he had lethargy, confusion, and they have described a waxing and waning sort of downward spiral with rabies. So maybe that does fit the picture a bit. I don't see a lot of rabies. I don't know that you guys do. So I don't know.
I've
We
never
might.
seen
We
rabies.
always think
You
about
don't
the
know, you
aggression and
might.
all that stuff. Man, maybe.
Are they dead? No, it's not rabies.
There's that description of maybe difficulty taking in water, and because of the problem with
You
swallowing,
left that
etc.
out. That would have been high on the differential if you would have said that.
I'm just giving you the information they
Man.
gave them.
Yeah, it
I
is
said
quite amazing how close an association there is between certain patterns of speech and diagnoses. So,
Mhm.
like, if somebody says, "Oh, this is the worst headache I've ever had," we're immediately like, "Oh, you popped a blood vessel," or for what? There's so many of those associations. So, I mean, definitely, you'll ask a patient something a different way, or ask a different leading question, and you're like, "Oh, this is what it is." But
Mhm. Yeah, if you would have said
it's
hydrophobia.
so imprecise, though, right?
Yeah,
Yeah,
with our
because if you said,
associations as
"Oh,
well.
a confused patient with frothing mouth and afraid of water," we're like, "Rabies."
Yeah.
Well, only in
correct,
retrospect.
correct.
But
Yeah, no, it's this is a difficulty, right? So there's a saying in medicine that if you listen long enough, a patient will tell you the diagnosis, but if you don't get the right phrases, and
I'm
that's
way too
not
impatient for
necessarily even
that.
on the patient. Like, how would you know what to say? You'd have to know what you have.
What
and
brings
have
you
to
in
know
today?
what we're listening for.
Okay, thanks.
Yeah,
Bye.
Okay. Okay. Bye.
So
Yeah.
So That is thought
Okay.
to be. It's
No.
not proved, but that is thought to be the most likely
No.
explanation.
Nope.
And maybe the
Not even
voting thing
close.
is second.
Not even
Mike
close.
disagrees.
Not
All right.
even close. I'm telling you, like,
what are the other? Okay, so we got
Of-
he was beat
You're
up
not gonna
and
let it
made
go.
to drink alcohol as a form of voter fraud, rabies, and what's the other? Is there another? Is there like number 2? Because you sound
mean,
like
there
you
was
said
the-
1 and 3 and 4.
I was making up a. I don't. They
The
didn't really
ordinal
rank
list
them.
was.
I don't know. Maybe
out
a
of nowhere.
brain tumor and complications, but
Brain
there's
tumor
like
because of the rattling around in the skull when
Yeah,
they
I
pulled him
mean,
out of the ground
you don't
23
just
years
you
later.
drop a skull and it rattles. There's something in there.
Here's the problem. This is what the case describes as the final common pathway of every
Disease.
illness that
Yeah.
kills you. Because like I think the reason he probably got lucid is whatever insult eventually killed him caused organ failure, and the organ failure led to death. But after the initial insult stopped, be it seizures, withdrawal, infection, then he got okay for a minute, but it was too late.
I think
Right.
Aaron's probably the closest, honestly, with the renal failure.
Yeah, but like
It
that's
makes
a
a
little
lot
bit
of
of a
sense.
cop out because why did his kidneys fail? So like I don't know.
Rabies.
That'd be the interesting thing. Like the rabies killed his kidneys.
I'm just kidding. It's not rabies.
This was a special. It was
Kidneys were frothing
rabies,
at the mouth, and they stopped
rabies
working.
nephrenicum, and
Wait,
it
so
went to his kidneys instead of
they
his
Made
brain.
that up.
They just have some random conference in 1996, and a guy stands up and says Edgar Allan Poe died of rabies from like a 6-line paragraph, and then that's now what people think.
I mean, maybe.
God, what in the hell?
Well, here's the other problem. So not only is there no autopsy, but apparently all the hospital records have been lost. Basically, they just don't exist anymore. So this was a fun exercise, right?
It is. Yeah,
I'm actually
fun.
angry.
It's really interesting that
Good. I'm glad you're angry.
Poe's death is a mystery, and what an enticing mystery. I mean, it's almost like if he was the one who originated the detective genre, he made his death essentially like the biggest Easter egg in all of history. He's like, hey guys, guess what I'm going to do?
Yeah, he wrote it.
Ooh, maybe it's in his writings.
Yeah.
What if this is an elaborate plot and he like put clues in his writings and that would help you figure out what happened, and then he did it to himself like halfway between, so he'd be in a weird city. No, you don't think so,
he
man?
wished on the
You don't-
monkey's claw, and he wanted to be immersed in one of his stories so he could write better, and then he was,
Did he write the monkey paw one?
didn't he?
I don't remember.
That could
I'm
be.
pretty sure he did.
Telltale Heart, I know. Raven, quoth the Raven, whatever that poem. It's not.
It's the Raven.
Are you Googling?
I'll tell you what.
Picture of Dorian Gray.
We
Didn't he write
appreciate
Picture of Dorian
everyone
Gray?
listening. We'd love to hear from all of you out there. If you'd like to check out our merchandise or provide feedback, we can be reached through our website, www.horrorhistorianspod.com. There you can send us messages and find links to all our social media sites. We do work to respond to all those posts on our various social media accounts. If you want to participate in the show, use our site to send us medical history trivia questions, to test Mike's innate knowledge, win your own medical eponym. He's bad at them, but I'm going to say get a little bit better with a half credit there. So it's like
2/5.
Yeah, he was actually pretty
Wait, that's
close. I
less
got to
than
say,
half.
the stern
I'm
was
giving
a,
that.
he's like a third. W.W. Jacobs wrote The Monkey's Paw.
I was going to use that to interrupt Max, but yeah.
If
Oh.
you have time, please go and leave us a nice 5-star review on iTunes or whichever platform you choose. And if you don't feel like doing that,
Scooped
just
ya.
tell some people about the show. If you're old-fashioned, pour out some vinegar into your yard in the shape of the words you want to say, and your message will appear to us soon enough. Just go try it, see what happens. Don't do that. Until next time, the Poor Historians are signing out AMA. Thank you. Hello.
Room noise, except for the deep breathing in the back. That's just going to be in the whole episode.
That's all right. I remove it all. Anyway, it's just extra work for me. Who cares?
I like
Not a
passive
program.
aggressive Max. This
No.
one's my favorite. Like, that's fine. I'll just
It's fine.
take it.
No, I'm
in
fine. I'm
post.
fine. We're fine.
It's great. We're all
No,
fine.
it's fine. Keep dropping F bombs.
ahead.
You know how many of those I had to bleep
Make
out
it-
last episode?
Make another joke.
Yeah, I think it was 3 or 4.
I want to say more like 6 or 7.
I didn't listen to I didn't listen to the whole thing. I'm not finished with it yet.
All right. Episode 62. I don't know. I also
That's a
like,
cool one.
the fun part is now, instead of like editing out cuss words, I get to edit out glass clinking. from
Sorry,
Aaron, who's
sorry.
like always has the biggest glass of ice, and he's just like,
Sorry.
I'm thirsty, clink, clink, clink. And my
looks like
favorite was
the
the last
ice-
episode where it was just like literally, I'd just be listening, all of a sudden I'd see this little spike come up, and it'd just be like, as he's like just
Chewing
eating
ice.
ice into the microphone. Thank you,
Uh-oh,
sir.
Aaron. You know what that says?
ASMR. ASMR. Yeah, I have pica. You gotta go.
Aaron's pregnant.
It means he's yeah.
Okay.
And
should
we're
probably
back.
share
Welcome
my
to the Poor
screen.
Historians podcast, where we delve into the medical mysteries of the history of the world.
I hate you. All right. Can you see?
I'm Max, and
Can
I'm
you
here
see-
with a couple of dudes.
Two dudes.
Two dudes hanging on the porch.
My job is hard. Can you guys read that?
Sassafras.
No.
Yes.
You can?
Yes. Yeah.
Oh, man, I
Can't you
don't-
see? He's just said sharing his screen. You can't see.
I'll be one of the docs.
It's
Oh,
so
you
Doc
tiny.
one
said you
and Doc
can't.
two.
You can't read the print is too small. It's because
No,
I have
it's
a
like
big ass computer.
All
Ha!
right. Aaron
well,
and
it's
me.
ass computer. Okay. Wait, so
Skit.
what am I doing?
You're an ass
You're
computer.
hanging out.
Can I just
Skit.
make ice clinking sounds?
You're not Aaron.